The three delays model are factor affecting utilization and the outcomes. Phase of delay. Factor affecting utilization and the outcome. Socio-economic, cultural factors. Accessibility of facilities. Quality of care. Phase of delay. Phase 1. Deciding to seek care. Phase 2. Identifying and reaching medical facility. Phase 3. Receiving adequate and appropriate treatment. Three delays model. Delay 1. Factor affecting utilization and the outcome. Socio-economic or cultural factors. Illness factors. On total recognition of complication. The perceived severity and etiology. On the sociological issues. Imota illegal abortion. Serala sanctions, permission on infidelity. Women's status. Hala, hadoli. Access to money. Restricted mobility. Value of women's healthy. Gati fayuma adolescent. Economic or educational status. Positive or negative association. Negative rohan positive quality. Indomne rohan has and managing waldasan. Phase of delay has almost offer deciding to seek care. Tahajilaka arkazan murtihan abuju. Hanat. Three delays model. Delay 1. Factor affecting utilization outcome. Perceived accessibility of distribution, the location of healthy facility. Tabilen fayela. Makatar gavani fi iddu hanim fagenyar jiran. Distance, transportation, gejiwaji wal qadamon. Cost is keti exceed expectation or ability to pay. Kavalti tilmam dendeng gudda fasi kadani. Perceived quality of care. Previous experience or experiences of others. Untono daran yohan mutono hadore alani. Effectiveness of previous treatment. Satisfaction of service. Staff attitude. Alalcha. Namoto chaiso jutani. Chumile ronis. Delay 2. Arkivada lamava. Factor affecting utilization in the outcome. Tufida umavi. Bua furat. Untono mid actual accessibility. Distribution, the location of health facilities, distance, travel time, outcome, occurring transit, transportation, publicity, available costs, cost exceed expectation or ability to pay some money. Malja phase 2 Salamafada identifying and reaching medical facility. On to the Gufutan, Durano, Tabani, they would delay factor affecting utilization the outcome. Actual quality of care. Actual quality of care. Tajile filatawma ugate. Poorly staffed facilities. Abile nama gang amne yohan bilchinang amne. Staff numbers. Lakuza nama chakadiru. Competence of personnel. Competence of gasinyan. Bilchinang umma sanirin. Nama kakawute. Poorly equipped facilities. Meshumma makasan kesel jiru hakan kayohan getiwalai unavailability of blade yohan kini hadiga musutu banking diga fayra chudabu unavailability of drug or chidia chudabu unavailability of other equipment meshale mbira gadada dabamu hard currency problems inadequate management ogunsa that aba yohan malamaltu maqote olu wanga wuni incorrect diagnosis and sanction. Hala corona dugura hanu tanonga guma dula kaga mon Delays the for request the for become receiving adequate and appropriate treatment. Well dancer, Sri TV. Mijata one kakao, Arkajuda Buruti. Maternal health service. Women health needs differ from those of men because of biological differences, gender differentials in exposure to risk factors. Unlike men, akadira osontane women need health service even when they are not ill. Kusa chule batu. Akadira osontane dubartin sayilo arkachu kabdi. So ya kabdi prevent unwanted pregnancy. Ulfa intane fa raigu carry wanted pregnancy. Ulfa barbaachisoota sirriitti tajaajiluu and deliver safely akka sirriitti nagaa fayyaan akka teessu goosuu. Based on that concept of informed choice yaadrimee filannoo akka qabeessa ta'e dhugaadhaan maternal health service should include maal fa'aadha tajaajiloonni kan qabu. Perinatal care that is focused and effective. Xiyyeeffannoo qabuu fi bu'aa qabeessa haa ta'e dhugaa ulfitti qabate irraa eegaltee jechuudha. Hordofii akkuma gurgurdi seel qabaan. Adequate delivery assistance and provides obstetric emergency. Rakkoolee adda addaa kan dhufne wantoota fi deeggarsa akka sirriitti isiin haalaan deessu godhuudhaaf achitti deebitee godhamu filaalu postnatal care tajaajila da'umsaa habootaa jechuudha. And education on safe motherhood. Barnoota fayyaa kennu referral service for pregnancy, childbirth and abortion. Yoo ulfa baasan ta'e haala mijeessanii yoo ol dabarsan ta'e ol dabra yeroodhaan jechuudha. Ensure skilled attendance at delivery. Ensure skilled attendance at delivery. Bakka da'umsaa sanatti skilled nama muuxannoo akka qabu gahee qabu jiraachuu isaa ta'aa jechuudha. Many women and newborns develop complications during or immediately after birth, which is difficult to predict and require a skilled attendant to manage appropriately. Having skilled attendants at delivery is one of the key interventions for reducing maternal and perinatal mortality. Who are skilled birth attendants? SCBA are skilled birth attendants are defined by the WHO a trained midwife with this to legisri nurse or midwife or doctors or public health officers who have completed a set of course of study and are registered or legally licensed to practice. TBS, traditional birth attendants, including those who have been trained, are not defined by the World Health Organization as skilled birth. Fedho haalin jiru dhagaa haa ta'u, da'umsa aadaa wal qabatu ganta keessatti haawwan kuni skill nama muuxannoo gahaa qabu jee hiikan kan nu yaadne jedha. Harmful traditional practice and reproductive health wantoota miidhaa fidan jechuun qaamota wal hormaata irratti fayyummaa wal hormaata irratti describe and understand the harmful traditional practice about violence against women, female genital mutilation, dhaqna qabaa kan qabne, early marriage osoo umriin geenye heerumuu, marriage by abduction, buuta triqiidhaan fuudhuu, beneficial positive traditional practice tokko prolonged breastfeeding and the baby message sirriitti kan luuzisan ilmoo dhuguu kadhaltees fi daa'ima kana sukkumuu, having absolute rest and nutritious feeding for delivered mothers, boqonnaa gahaa guutuu qabachuu fi nyaata gahaa argachuu eegalte. Establishing traditional social welfare organizations idir iqub waldaalee hawaasaa kan jiran quubiifaa wal buufatu jiraami iddiriifaa kana jiraa fooshaa والنون كان أنا سير أكاس أميات ونديسنيشو أكون مني في كذا الغرقة على يسوع. Inhaling is the steam of leaves for common cold and bronchitis. إنسان كنا مرة عادة سيف هذا كونجا بالا مه وهيتو عدد دجرة أرسنيفا كا يروق فانك أبيه بكون راويوت. Conscious eating of garlic for its therapeutic values. كلوبي نعتقد نعتقد religious and cultural restriction of premarital sexual practice. Amantifia. Ada antane walk abate ichu. Usuher mungkin fa. Harmless. Neutral. Traditional practice. Mita sing kamani amma isang kone iddu magali irani. Tokofan hugging, tying a knot of crushed leaves or fruits on the neck of a child with an assumption of prevention of evil spirit. وانا كقرطاسه ماري خلطو وهي يعني اتيرو يجبدوا على راينا يعني
رايغو
ايه
سننتو
صدفه نكي ميدان كمان harmful traditional practice or ميدا كمان female genital mutilation kana kama jiralaiju tokofa reasons for female genital mutilation preservation of virginity nuruma isisane ayna ichudafi increase of matrimonial or marital opportunities. Heruma kopesua. Prevention of stillbirth in primi gravida. Example, Burkina Faso and Nigeria. Improvement of male sexual performance. Akasiritika. Maintenance of good health. It cures women with epilepsy, hysteria, mental health illness, insanity, foolishness, depression, etc. Residents in Ethiopia break utensils. Especially made of moors. Make her weaker and obey her husband's command. It is regarded as a religious obligation and types of female genital mutilation. Type 1, Sunnah. Sunnah involves the removal of the prepuce of the clitoris. Common in most of African countries. Sunnah يعني kamu kata kare sayang ramurnya type 2 clitoridectomy gutuma tu ramurnya hasu removal of the prepuce and the clitoris pakat ram kasu hasun na yusun fi internet tibar hundami khana badan type 3 excision removal of the prepuce clitoris and the labia minors khana badan wasdafa bakumata kat wa hundur ragas. Type 4 infibulations or pharaohic type, the most aggressive one. Badanga involves the removal of prepuce, clitoris, labia minors, and majors. Complication of female genital mutilation, immediate complication, shock. Pero ini kayak samura itu. Acute urinary retention due to extreme pain. Fincan rabo kon kamele guba ma akaramban wa khalifa itu septicemia ko digaul qabat tetanus ini kadu kona kaisa nama kani wala nya genital urinary infection ko ba am salatu qabat this do alif da long term complication khadura khata tamade kona mu khayro deradi wound super infection Madana darat bahu lukuma jin pelvic abscess malafon kun painful intercourse yero da jarse dam lukubu kamale recurrent UTI dhukkuba saalaa wal qabatanii wajjin amma nama deebi'u infertility secondary to PID. Hormaata irratti rakkoodha jira. Prolonged and obstructed labor with all its complication both to the mother and the newborn. Yeroo deemsa irratti rakkoo biraas hin taasisu. Daandiin tuqifanii. Early marriage. Osoo urumiin keenya jiru, various studies have shown at more than 60% of Ethiopian girls marry before the age of 20. Osoo umrii deeman keenya jiru, percentage jaadan Itoophiyaatti. In some areas, the marriage occurs as early as 7 or 8 years. Complication of obstructed labor ranging from intolerable pain and prolonged labor to lifelong disability and disease. Some of the reasons for early marriage are parents' desire to see the marriage of their daughters and their grandchild before they die. Akaakonni si ilmoon tun daftee haaromtu ilmoo si arkuu qabaa osoo hin duune eefa strengthening of the family business ties between the two parents yeroo hannatu gurgurachuufa increasing possibility of a daughter for getting marriage, avoid premarital sex or loss of virginity and its consequences. Harmful effect of early marriage, preeclampsia, prolonged labor and obstructed labor, fistula, hemorrhage and shock at delivery, stillborn babies, loveless marriage. Herumte jaalatin jirtu joka isanamu difficulty managing a household, lack of education and employment opportunities, divorce, straight girl prostitution, practices for child spacing. The idea of child spacing is a very ancient one. Mankind in history has attempted various methods of spacing, some of which are as follows. Drinking frothy sweet of camel, instilling lemon juice into the vagina, blocking the opening of the uterus with tallow or animal fat, washing the genitalia with salt solution before and after sexual intercourse, practice during pregnancy and childbirth, unwisely manipulating the birth canal and the fetus, severely restricted weight gain during pregnancy, taking Koso on monthly basis to purify beliefs, damage to kidney and liver, congenital malformation, piercing the tongue of the woman in labor with sharp material, kneading or massage and squeezing abdomen to induce labor, uterine inertia, prolonged labor and also excessive bleeding during or post-delivery. For the retained placenta, shaking